Evening everybody, welcome to Care Fertility's egg donation live event this evening. I'm going to be shortly joined by Lisa and Julie from Care Manchester, and sorry, I was just someone popped into the office. I'm going to be joined shortly by Lisa and Julie from the Care Fertility Manchester team, discussing egg donation and egg donation IVF. So my name is Chloe and I'm part of the Care Fertility Manchester team as well, so work closely with the two of them. We've also got lots of events on this week for Fertility Awareness Week, so we've had Amy and Victoria last night on optimising fertility treatment. We've got Zita West and Charles Kingsland tomorrow. We've got Rima Rajkawa from Birmingham on Thursday, and then we've got our virtual information event on Friday. So hopefully a lot of you can join us. So I'm just going to invite Lisa and Julie on in just a second to join us. Please submit any questions throughout the event, any comments, and I will try my best to cover them in the Q&A section in a little while. And anything that we don't cover, you can send to us later on and we'll get one of our team to answer them for you. So just send us a DM. So I'm just going to get them on now and then we will get going. I'm just going to turn the camera. And they should be with us in just a second. There we go. We've got them both. Hi, guys.
Hello.
Hi. Yeah, you can hear me properly and everything, can't you?
Yeah, we can hear you. Can you hear us?
Real. Yeah, no, you're absolutely fine. Lovely.
Wonderful.
Brilliant. So, do you want to do a brief introduction of yourselves and what you both do at Care?
Absolutely. So my name's Lisa. I manage the donation team at Care Manchester. So any patient that is becoming a donor or needs to use any donor gametes, I oversee both the team and the patients.
My name's Julie. I'm a donation nurse here at Manchester. I've been with the team for about 12 months. And I have the amazing job of working with all our lovely donors, which is very rewarding. So that's me. I'm just going to say one thing there, Chloe. We're struggling to hear you. You've gone really quiet on us, sorry. But I'm just going to start off by talking about if you are considering donating your eggs with Care. First of all, I'd just like to say a massive thank you because it is such an amazing and wonderful act of kindness and generosity. We're always really grateful when people come forward to donate with us. It helps so many people just achieve their dream, basically, of starting their own family. So thank you in advance. We are always really grateful. The first thing that we would say to you to do is direct you to our Care Fertility website. You can register your details as a patient. Make sure you include your full name, phone number and email address. And once you've given those details, you will automatically be sent some information. We have a lovely care patient information leaflet that provides all the essential information that you need regarding donating your eggs. And once you've decided that, yes, you are considering donating your eggs, you'll be then sent some questionnaires to complete about your own medical history. Just a few things to point out if you are considering donating your eggs. So you must be under the age of 35, ideally about 6 months before your 35th birthday. Your BMI does need to be under 35 as well. That's just for your own safety, basically. You need not to be pregnant yourself. And if you have recently had a baby, then at least 6 months. If you've had a cesarean section, it would need to be about 12 months. You also need not to be breastfeeding. And if you've stopped breastfeeding, you need to have had your periods, for the last 2 or 3 months. So if you just consider those things before applying. As well, if you are taking the depot injection, you would need to have stopped that and then wait for your periods to return, which can take some time. So ideally, we'd like you to have stopped that and be having regular periods. So they're just the things to think about. The actual screening process then for donors, when you are decide that it is for you, we will send you some clinical questionnaires that we ask you to fill in your own health and your family's health. So just be mindful and make sure you are able to provide 3 family generations, so they can rule out any genetic illnesses. So the forms are quite in depth. There are quite a lot of questions to ask, but you know, we need to make sure it's safe for you to have the treatment and that it's right for you. And also, if you do successfully donate your eggs, we need to make sure there's no risk to future children born. So that's why we need to obtain that 3 generations of history. So those forms will then be reviewed, and all I would just say is put as much information on there as possible. You know, if there is an illness in the family, or there's something that you need to tell us about, just be quite in depth. One of our consultants will then review those forms, and if you're all signed off from that basis, your next port of call will be a telephone call with one of the donation nurses. We'll spend about 30-40 minutes talking you through the donation process, a little bit about the law in the UK surrounding donation, which we can touch upon at some point tonight. Talk to you about the treatment, what the medication is, how we set you up, what the procedure involves, just so you're fully informed and get a whole true picture of what the egg donation process is. If you feel that you want to continue after that point, the first thing we would need to do is look at your own fertility. Obviously, we need to make sure that you're nice and fertile, so we do that by doing a blood test. We look at your anti-malarian hormone, so it gives us an idea of you know, your egg reserve, and we'll do an ultrasound scan, so it is an internal scan, and we'll be looking at your ovaries and doing what we call a follicle count of each of your ovaries, and it gives an idea then of how you'll perform as a donor. So after that, if all is well with that, you'll have another appointment with one of the donation nurses, and we like to talk to you then about all the consents that you have to fill in. You have the opportunity to fill in what we call a donor information form, which is it's a wonderful form. I think it's my favourite part of the job, reading what all our amazing donors write about themselves. You know, you can write about your hobbies, your interest, just to give us an idea of the kind of person that you are. It's a bit like the person behind the donation, and like I said, the consents, and we'll show you the injections, the medications and things like that. You do have the option of having counselling as a donor, so to talk about the implications, just so you understand what it means for the future, really, of what it means to be an egg donor, so you do have that option. And then we'll invite you back as well to clinic if you're kind of happy with everything, for some full donor screening blood tests. So we do have to do quite a lot of blood tests, and they include what we would class as genetic bloods, to make sure there's nothing that you have that you could potentially pass on. So things like cystic fibrosis, sickle cell anemia, thalassemia. We do what we call a karyotype, which is to check there's no chromosomal abnormalities, and we also do all the sexually transmittable diseases as well, so HIV, chlamydia, syphilis, gonorrhea, we do all of those. So if you kind of pass all the tests, if you like, and you complete all the consent forms and you're happy with everything and we're happy with everything, then it's a case of setting you up for treatment when it's convenient for you. And I'll just point out that the treatment does involve injections that you administer yourself on a daily basis. So sometimes people are a little bit put off by that, or they're not aware of that. So I'll just point that out now, that it is injections, that you can't take them at oral medication, it does have to be injections. And it's roughly about 2 weeks, up to 2 weeks of you taking the medications, and you'll then come in for scans to monitor that medication's doing its job, basically. And then you'll be scheduled for your egg collection. So that's kind of the process, really. And I would say, all in all, from completing your forms to kind of being signed off and ready for setting up your treatment, it's about 3 months. So it's a bit of a commitment. And we do understand that people are busy with work and what have you. So as long as you know your work is supportive and family life is supportive, and that you can commit to it, that's all. Really.
Yeah, it's sort of a really special thing to do. Like, I know you touched upon donors being able to like describe what they're like, what they do. So it's not just matching down to characteristics, it's kind of matching down to the little things that people care about as well. Like, they want that to potentially be reflected in their child born, or just being like, I have a lot of things in common, like a recipient saying, I've got a lot of things in common with this person who's donated. So it's really nice.
Yeah, exactly. Helps with the decision making process, and like I said, it's a real privilege. It's one of my favourite parts of the job, to read all the amazing things that you know, the reasons why people want to donate in the first instance. A lot of the time it's, you know, they've got friends or family that have been struggling to conceive themselves, and they just genuinely want to help somebody else. You know, so like I said, it is really a wonderful act of kindness, and we're always dead grateful.
And a comment's just come in saying that they're having their egg collection tomorrow for their egg donation. So
good luck then. Yeah, well done, thank you.
Good luck with everything tomorrow. You'll be in safe hands.
Definitely.
Absolutely. So Yeah, brilliant. Sorry about before. I realised I put myself on mute for you guys to talk, and then said, "Oh, you're going to cover the donor pathways," and I was like, "Oh, I'm actually
read you, okay.
I've gone silent." So yeah, schoolboy error from our first Instagram live, as you can tell. So yeah, are we going to then touch upon a little bit with yourself, Lisa?
Yes.
Yeah.
So a big part of my job is looking after the patients that come to us because they need to use donor eggs. So the first process is to register on our website. So a really straightforward form with your contact details, and it's a self-referral form, so no need to go through your GP. It's just really straightforward. And then a member of our GEM team, so the General Inquiry team, will get in touch with you to make appointments. And the first set of appointments is to come and speak to one of our consultants, and they'll run through your history. We'll also have a scan and a semen analysis. So we're just making sure that you are absolutely fine to have treatment. There's nothing that we need to look into. And then once you've decided that that using donor eggs is the course of treatment for you, we make appointments then with a member of the donation team. It's a big decision, and there's a lot of things to think about. So the appointment will be around an hour and a half, and in that appointment we're there to talk to you about all aspects and the process of having treatment with donor eggs. So we will talk to you a bit about the donors, about how we assess them, about all the screening that the donors have done. We'll talk to you about the different options of using fresh eggs, frozen eggs. We'll talk to you about costings, and really it's an opportunity for you to talk to us about your concerns, your questions, so that you can kind of have a full outlook really before you make any decisions to go down that route. You also then speak to one of our counsellors, and the counsellor's there to talk about the implications. So how do you feel about using donor eggs, both the patient themselves, the partner, and how will you feel in the future? So we just need to make sure that you are fully informed and you feel completely happy. After you've had those appointments, we kind of send you on your way, if you like, and say, you come back to us when you've made a decision. Now, some people say straight away, no, this is something I want to do. And some people take a little bit of time, which is absolutely fine. So once you come back to us and say, yes, I want to have treatment using donor eggs, then you become part of our patient list. So that means that you are under our care. So you designated a nurse or a member of the donation team to guide you through that process. So at each point we kind of let you know exactly what you need to do, whether you need to have a scan, whether you need to have blood tests and things like that. Now once you have access to either our frozen egg bank, so there's two options. You can have frozen eggs, so where our donors have already had their egg collections and their eggs are frozen, or you can have a fresh synchronized cycle, which means that you're matched via ourselves, and both you and your donor will be having cycles side by side. Like I say, we talk through all the different options with you. Now, if you choose to have frozen eggs, the process is really, really simple. We have a central egg bank. So you go on yourself via your secure patient portal, and there you can see the patient's characteristics. So you will see the ethnicity of the donor, the height, the BMI, their eye colour, hair colour, and also if they've got proven fertility, so if they've got children themselves. And it is really as simple as picking the donor from the egg bank, and that then sends the information to the clinic that you're having treatment, and it's our job to make sure that we get the eggs to the clinic that you're having treatment and set up your treatment itself. So we'll organise any consent forms that need to be done. We liaise with your consultant, so they'll put together a personalised treatment plan for you. And like I say, we're there really to help guide you through the process. So a lot of people, they'll have they'll have questions, and they want somebody who feels like they can just get in touch with a person.
Yeah.
Now, the treatment of being an egg recipient is normally really quite straightforward. So most people just take some estrogen tablets, so not injections like the donors need to do, and just some estrogen tablets from day one of their period, and then some pessaries once the egg thaw is planned.
Yeah. Ah, well, it's actually sort of really streamlined, isn't it? The process. It's
Absolutely.
Try and make it as simple as possible for the patients to ensure that they get it's stress-free. It's a very highly emotional time anyway, so the more that we can do for them, that's always kind of been at the heart of what we do, isn't it? Making sure that they feel fully supported throughout, which is great. So yeah, no, that was really informative, really detailed, I think. So it shows what goes through for the donors and then for the recipients. So I'm just going to move this quickly. So we were just going to go on to probably the pathways and then on to the support that we have, aren't we, as well?
Yeah, so I briefly touched upon the pathways there. Like I said, the different appointments that all our donors have to have. So like I said, there's the genetic questionnaires, the appointments at the clinic, all the screening. There is quite a lot of appointments to do, and we are quite strict. The parameters that you need to hit, and all the tests and everything, for obvious safety reasons. Like I said, we need to make sure it's safe for our donors to have the treatment, that it's right. But also to make sure that there's no risk. So that's why there's quite a lot of tests and
it's stringent for both. For, like you say, safety of the donor, but then the recipients want to know all this information as well. It's really important to them, isn't it? So we've just had a question or two sort of around donation and contraception. I think we'll cover that in the Q&A if you want a little bit later. Is that all right? Yeah. Perfect. I'll add that to the list. So again, just a reminder to everyone, please send any questions through. I will try and get as many of them covered this evening as I can. So just keep sending them through, because the team are really keen to give you all the information that you want. So yeah, we'll probably touch on support then, I think, shall we?
Yeah. Support wise, I mean, we have a designated support team for our donor support. So they're a central team. They have a central number, so that they are there for supporting the donors.
There's email, there's phone number, and then when you come through to your own clinic, I know for Manchester, I tend to be the one that looks after donors. Each clinic will do things slightly differently, but there's always somebody there at the end of the phone, always somebody there at the end of an email. No question is a daft question. We would rather somebody ask us a question and be sure than not ask and be stressing. I get lots of phone calls or emails. Can I just check this? Can I just check that? We would rather that. We want you to understand, exactly what it is, or how to take your injections, or can I have my flu jab, or, whatever question you've got. There's always somebody there at the end of the phone or the email to make sure that experience is as straightforward for you as it could possibly be. We're quite proud, I think, aren't we, of how we treat our patients, our amazing donors. We want you to have the best experience that you possibly can. So yeah, there's always somebody there at the end of the telephone for you.
There is.
And the donors, like I said before, they're offered counselling as well as a secondary support. So if you did feel that you wanted to have a chat with a counsellor just about the implications of what it means to be a donor, then that is there. And if they felt that they needed another option, another session of counselling, that is there as well, which is the same for people using donor eggs as well.
Absolutely.
Isn't it? Yeah.
Yeah, we do really take pride in looking after everyone, don't we? We say it.
So,
absolutely.
We say it all the time, but it really is reflected in the care that everybody does receive when they're in the clinic. And obviously the feedback that we get is really, really positive as well. So yeah, it's nice. So hopefully people who are considering donation, this is going to be really useful in helping them maybe make that decision if they want to move forward.
It's quite a daunting task, isn't it? And I think it can be a little bit scary right at the beginning, but I think what we want to portray is that you are supported. We're experts at doing this. We've done this for a long time, and we see it as kind of being, as part of your team, and to see, we genuinely want the best outcome for all of our patients, and the whole team in each clinic feel exactly the same.
Yeah, because even though donors and recipients don't ever meet,
Never meet.
you want to make sure that they know the impact that they're having, donors are having, and that the recipients are truly, truly grateful.
Yes.
You know, because
Yeah,
we're in that in-betweeny person.
Yeah.
So just they can't ever meet, but we want to make sure that the donor knows how much it's appreciated from our recipients, that they're coming through and doing this to give them an opportunity to try for a baby when they might possibly have never been able to do that. And the same goes really from our recipients. They're so thankful of the donors. We kind of want to make sure that they do know that it's really appreciated. It's
and I think a lot of our donors, I always like to go and see them after their collection, and some, you know, and a lot come through again. When can I do it again? It was an amazing experience. And I've had a few people say, I feel so proud of myself that I've done this, and it's like, you should be proud of yourself. It's an amazing thing to do.
Some people probably come in and don't realise the impact of what they're doing, but they certainly know about it when they do leave. Once they have done that cycle, which is so nice. So it's such a good topic to talk about, because it is just so positive and so lovely.
It is.
It's great. Shall we move on to fresh cycle versus frozen cycle, and then we've got some Q&As to do. So a lot of it, some comments are coming through, but I think they are very similar questions, so hopefully it will answer everything that they need. So yeah, fresh versus sort of frozen cycles, I think.
Okay, I think the main points come across is this is a very personal choice. So statistic wise, fresh eggs, these frozen eggs, is almost identical in the success rates. So it comes more down to the experience. Now, frozen eggs is definitely a more straightforward process, and some people like that they get to choose the donor themselves, so they feel a little bit more in control of that. In which case, you know, they go onto the egg bank, they choose the characteristics and the set size of, so in the frozen egg bank there's 2 different options to make it a little bit more accessible for all types of patients. So they choose the set size, as in how many eggs are in a set, and the characteristics of the donor. And when we was just talking about the donor information form that the donors write, we redact any identifying information from that form, and then that form can be given to the recipient, so they actually get to write what that donor's wrote about themselves, and they can make a decision then based on that whether they want to continue on with using those eggs or not. Like I say, the eggs have already been frozen. Only mature eggs are frozen, so you guaranteed that number of eggs. Okay, so it's quite a straightforward process. And then the recipient, as soon as all the consents are signed, blood tests are done and all that kind of thing, they just start on their natural period then. If they prefer to have a fresh synchronized cycle, then that's where we'll do the matching. So we'll ask what kind of donor that the patient wants.
Sometimes it's not just physical characteristics, is it? Sometimes they're looking after someone who might be a bit sporty or athletic, or
it can really vary.
People's requirements are a bit different, aren't they?
And the same being, some of our donors don't like the idea of just their eggs being frozen and to be used at a later date. They actually like the idea of synchronizing with somebody and feel more connected to that person. So we do give the choice. We ask our donors, you know, which way, because it can be a little bit more simple if they're just going on their own cycle, to freeze their eggs if they're very stuck and they need to do it within a certain time frame. Whereas some people, if they want to do a fresh cycle, then it's a case of synchronizing periods, because obviously you need the bodies to be in sync with each other. So we would look for a certain type of donor for them. And same process. So we'd tell them all about the donor. They'd get to read the donor information form. We'd match them together, get the periods in sync, and set up cycles for them.
Yeah, brilliant. Yeah, I like that. But it's, you know, you kind of go through the process together. And then, yeah, because then you know that if it's a fresh cycle, then they're probably going to be having an embryo transfer not long after you've had your egg collection. So it's kind of nice to think about that, you know, those things are kind of going on straight after you've done it. So, yeah, that's brilliant.
In the same way, if eggs are frozen, they don't tend to stay in the frozen egg bank for long.
They won't stay there for long, will they?
You know, there is quite high demand for donor eggs.
Yeah, definitely. And it's really good that we do have then the bank available and people can sit and have a look through and really take their time with it as well, which is really special, which is nice. So.
Time limit, they're given access to the bank. Some people choose some donor eggs within the first couple of days of being given access to the bank. And some people it takes a bit of time and they would prefer to just kind of take their time looking at different donors and might not want to choose them straight away.
Yeah, definitely. Well, that was really good and really informative. If there's anything else that you want to add in, just let me know. But if you are happy to, we can move on to the sort of the Q&A section. So some of the questions we've already had submitted already, and then I'll keep an eye on any more that do come in. So the first one that we had is, what characteristics can I filter the egg bank by?
So we normally say when you are first given access to the bank is to leave all of the characteristics blank, which means that you'll see all of the different donors that are available. It's not the donors that are available, it's their eggs. So you can see everybody, and then you can filter. So you can filter by ethnicity, hair colour, eye colour, skin tone, and the proven fertility. So you can put in, if you're very specific in exactly what type of donor that you want to have. A lot of people want somebody that looks like them, so they will literally put in, I want somebody, you know, with brown eyes, brown hair, because that's something that's really important to them. Yeah, definitely.
Can we filter by things like religion, or is it just if we know that about the donor?
You can't filter by religion.
There's not a filter for religion, and it's only if the donors wrote about that in the donor information form. So like I say, you will pick a donor based on characteristics, but that doesn't necessarily mean you have to have that donor specifically. You can then ask for the donor information form, read all about that donor, so their reasons for donating.
And there is a section on the donor information form for religion. Follow a religion, they do often state it, or if they don't, they'll put, you know, none or not. But it is on the form.
Because I bet in what some donors have written about themselves, some people might read it and go, oh my god, that's happened to me, and they sort of connect on that level and go, yeah, that person's perfect for us.
So people actually read the donor information form and think, oh my god, this person's just like me. They love animals, or they love, you know, certain things, or something that they just really connect with the donor. They get that connection, and it's got to feel right. You've got to feel that you've picked the right donor eggs for you. Yeah, absolutely. And I think that just is really special, because I don't think a lot of donors know that we go that detailed. So I guess it's nice for them to know. So, sorry, I'll just uncover some of these. We've covered it briefly, but if we did what support is available as a recipient, I think we've covered that, haven't we? Yes.
I'll just make sure. I haven't written these down, silly enough, but I'll just rest my iPad. So the next one, has the pandemic affected donation services?
So it did, didn't it?
It did, yeah. So obviously, like a lot of clinics, a lot of the care clinics did close for a spell. There wasn't a lot of time that we was closed for, but it did have a bit of an impact on donors coming through. We've recovered really well. As soon as we've opened back up, we've had lots of amazing donors.
I was going to say there was quite a lot of disruptions, especially when the vaccinations came about. You know, we didn't want donors not to have the vaccination, so we'd have to move treatment, or somebody was testing positive and we'd have to delay treatment or delay appointments. So there was quite a knock-on effect of COVID. I think recently, these last few months, we've noticed a decline in that. So there's not been as many disruptions to appointments or to treatment plans. as there was earlier in the year.
Yeah.
For definite, we would have definitely noticed
Recovered
that.
well, I
Yes,
would
definitely
say.
recovering well from
Yeah.
that.
Oh, good. Yeah, because I can imagine it sort of being a bit up and down, especially in the sort of the start and the middle of the pandemic when everything was a bit wild. So that then leads us on nicely to the next question, which is probably asked quite a lot. Is it safe to have the COVID vaccine and still donate? It doesn't affect treatment or outcome or anything, does it?
No, the only thing we say, obviously, have your vaccine. We don't want you not to have your vaccine. The only thing we would say is there needs to be a period of 7 days from you having your COVID vaccine to then having your treatment, or should you experience any side effects, 7 days from those side effects, wearing off. So just notify your clinic if you are having the vaccines and what dates. And if it does coincide with treatment, then have your vaccine and would just move your treatment.
Yeah.
But
So there's no
a
significant
little time frame.
Yeah, no significant delay, like you say. No, that's good, because I think that's what people are scared of. They're like, oh, well, do I need to wait a few months then? And they don't sort of want that really.
No.
So
The only time you wait a little longer would be if you tested positive for COVID. So if you tested positive for COVID and you was being set up for treatment, you'd need to kind of have at least 28 days of any symptoms of COVID, subsiding before starting your treatment. So that's only a bit of a delay if you actually had COVID.
Amazing. But yeah, if anyone's ever unsure, they can always just contact the team, can't they?
Yeah.
Person available. Amazing. So then that leads on to, is there then any side effects potentially of the medication that we give?
Lots of people ask me this about the side effects for the medication. There are not really many side effects. Everyone experiences things a little bit differently. The most common side effects that people have expressed would be, some people maybe get a bit of a headache when they first start taking the injection, so just stay really hydrated, just drink plenty of fluid. Some people, one of the injections, because there's 2 different injections that you take, one is dead user friendly, everybody really likes that one. One of them, some people say that it stings a little bit going in, and you might get a bit of a localized redness where you do the injection, a little bit of stinging, like I said. Some people say, towards the end when you're nearly ready for egg collection, you might just feel a little bit more on the emotional side, but not everybody's affected like that. And in terms of avoiding, the stinging, if you take the injection out of the fridge, just leave it in room temperature for maybe half an hour so it's not freezing cold going in. And perhaps, if you use an ice cube the area before you inject, it's nice and numb, so you might not feel that stinginess. But they're really the only side effects that have ever really been
you do injection teachers. We can show you the size of the needles as well. Can't we?
I always get all the injections out and show people, because you get a box of goodies delivered and it's like, oh my gosh, what's in here? So we get them out, show the needles, do a little injection teach. And on our website as well, we have some really good injection videos, because sometimes you might see your nurse at your clinic and then it might be a couple of months before you're actually ready for starting. We do send a link to our injection teachers online that you can do before you're ready to.
So you can feel really informed before you go in, and we've got, like you say, loads of information as well on the website and the videos.
Definitely worth having a watch over the videos before before that you're going to start your injections, for sure.
Yes,
and give yourself a bit of reassurance that the needles aren't tiny, and I think a lot of people, as soon as they hear that they've got to do injections, their immediate thought is that you've got this massive needle and it's going to hurt and things like that. But as soon as you see how small that they are, it settles your mind a little bit.
And it's just going into the tummy area. It's not going into a muscle. It's just the tummy area. We've all got a bit of an inch to pinch, some, just in that little fatty tissue. So it's not intramuscular. It's and it's seconds, literally seconds.
I think that's what people are scared of. Obviously, when you get your immunisations, they go in your arm, you get a sore arm. Just into the skin, isn't it? So it's that they are a little bit easier. And for some people, it actually has turned their fear of needles around, because they've had to do it themselves. They're like, well, it's not that bad.
I've had that with the patient. She's like, you have cured my fear of needles. So I was like, well, it's a win situation.
Yeah, definitely. So that's good. So this is going on to a little bit more in-depth things. So can I donate to somebody that I know?
Yes, you can. So you can donate to a family member, a friend. When it comes to your family, you do have to be a little bit careful. So you can donate to a sister or a female relative. We just have to be careful of mixing eggs with, if you was wanting to donate to your sister-in-law, and then it would be your brother's sperm. You have to be really careful with male and female relatives, but you
Yeah.
can donate to a, you know, to a friend. That was just classed as a known donation. So in terms of like the law in the UK and implications, you know, if you're doing it altruistically for somebody that you don't know, you know, if you're going to the egg bank or we're matching, you know, you do remain anonymous, but the donor conceived child at the age of 18 does have the right to find out who that donor was. So I know I've digressed a little bit here, but you know, they can find out the donor's name, date of birth, place of birth and last known address. They've got that right. Obviously, if you're coming through as being a known donor for somebody, then you know, you're going to know from the outset who you're donating to. But yes, you definitely can donate. We need to look at that family genetic link, that's all.
Yeah, no, that's really good, because it,
counselling and things to make sure it can be a little bit more complex. We need to make sure that everybody's aware of what they should be telling any future child born, and being open and honest and things about how everybody feels in that situation.
Yeah, definitely. And you easily covered another commonly asked question is, what can then children know that are born from donations? So obviously finding out your details when they are 18. Again, it's regulated by the HFEA that they go onto the register.
It has to be the child at the age of 18. It can't be any other family member. The child at the age of 18, technically they're then an adult, they would contact the HFEA directly, and that's the information they could be given. At the age of 16, they can contact the HFEA and request non-identifying information. So like that donor information form we spoke about several times, that's got like eye colour, hair colour, hat, anything that's non-identifiable, they can ask for that at age 16. But at age 8, it is basically identifying.
Yeah, and it comes from the patient, well, say the patient, I want to say the child born, not the mum and dad who would, so
child at the age of 18.
Yeah, hopefully mum and dad may have been honest and told them that they were born from an egg donor, and then it's obviously, the child might then say, you know what, but you're my parents, I know that I'm born from an egg donor, but I'm happy to not find out who they are. It's obviously that open choice, isn't it?
Yeah, and I think it's explained to our donors that they're the permutations, you know, they've got that legal right. Nobody's, that law changed in 2005, so nobody's reached the age of 18 yet. We're just a couple of years away from that. But they do have that right. They may want that information, they may not. If they do ask for that information, they may want to try and make contact, they may not. But there are the options, and especially with social media these days, and nobody knows how that's going to progress in years to come. You know, if they do know who you are, they may want to make that contact. And that's what some of the chats are about with our appointments and the counselling. Should you want it, how are you going to feel about that in the future? And especially if the donor's got their own children and things like that, you know, there's a lot to consider.
Absolutely.
That's law, and that's what they're entitled to know.
Yeah, definitely. We've got a couple more. I can't believe how long we've actually been on. It's 7:10 now, but we'll start to wrap up shortly. But if there's anything that we've missed, guys, send us a DM after the event and we'll get them answered for you. So what can a child find out? We've already done that. And the last one is, do I automatically find out about any live births from my donation?
So that would be a no. We don't routinely, we can't routinely tell you, you know, if your eggs have been selected or if somebody's pregnant. You do have the right to find out if there've been any live births. So we always say, if you give it 12 months from your egg collection, obviously give it time for a pregnancy to occur and a birth to occur, you can contact us and we can run a report. And should there have been a baby born, we can say, yes, there has. If it was a boy or a girl and the year of birth, but that's all that we could tell you.
Yeah. Brilliant. But some people choose not to find out, don't they?
It's personal choice, if you want, some donors really want to know, some don't, they're just happy that they've done their bit and that's enough for them. Yeah,
brilliant. We've got one last question if we can cover it, and then we'll do a bit of a sort of summary of how people can move forward if they want to do egg donation or get in contact with us. We did just have one. It might be a little bit of a complicated one, but so we can point them in the right direction. Can someone have treatment if they've been through menopause with donor eggs?
Yes.
Yeah, brilliant.
So because of the medications that we do use when we are using donor eggs, quite a lot of our patients actually don't have periods, but because we can control that with estrogen and progesterone, it's not actually a problem if somebody has been through the menopause already.
Oh, brilliant. Well, hopefully then that's reassuring to the person that asked on the thread. So I think that's pretty much everything, unless there's anything else that you guys want to add at all. But I would just say, what would be the next steps for anyone that is interested in either the recipient IVF or donating their eggs, what would be the next step from this video?
Our website has so much information on there. So I would say head to our website, filling in your information, and then we can contact you then to guide you through the next process. We'll provide you with a lot of information first and foremost, and then if you want to proceed, then we can make appointments then, either with the donation team if you're a donor, or with the consultants if you are a recipient.
Yeah, amazing. Well, thank you so much. We have again gone slightly over, but we've had lots to talk about, so hopefully it's been really informative for everyone that has watched. Thank you to everyone that has joined us. We'll be signing off now, but this will be posted across our channels, so if you want to recommend it to anybody, or if you want to send it to anybody, it'll be on YouTube and it'll be posted to our Instagram tomorrow morning. So yeah, thank you very, very much for everything, and hopefully you might join us for the rest of the events this week as well.
Okay, thanks very much.
Thanks, both. See you later.
Thanks.
Bye.
Bye. Bye.